Greetings. It's a pleasure to be with you today, and thank you very much for the invitation to join you in celebration of the 30th anniversary of the Americans with Disabilities Act. I want to congratulate the Illinois Department of Human Services for taking the time to recognize the accomplishments that have been made here in Illinois as it relates to people with disabilities and advancing the civil rights and social justice opportunities for everyone. Today, I'm going to spend some time just talking a little bit about where we've been and what we still need to do moving forward, because as we recognize and celebrate the 30th anniversary of the Americans with Disabilities Act, we have to remember where we've been, but we also have to keep focused on where we're going. The job is not yet done. So here's a quote from George H.W. Bush on the signing of the Americans with Disabilities Act back in July of 1990 on a very hot day, similar to the days that we've been having here in Chicago this past week, or actually the whole past month. One of his statements that is most meaningful is said, "Let the shameful wall of exclusion finally come tumbling down." After years and years of discrimination, of oppression for people with disabilities, the passage of the ADA meant everything. It was the civil rights law for people with disabilities. It wasn't, though, the end. It was just the beginning. And the past 30 years have taken us on a journey which we have seen many ups and downs. We've seen positives and negatives. And we've had many things to celebrate, but we also have had things to be of concern about. And we continue with that today. Not in anybody's lifetime, at least in not mine, would anyone have predicted that we would be facing what we are today with a world pandemic and the impact that it is having on our economy, on the lives of individuals and their family members across the country and across the world. In no legislation and in no policy anywhere would you be able to see that necessary or this particular situation predicted. Thus, we don't have a blueprint for how to respond. We don't have a lot of answers yet in regards to just exactly how does some of the things that we are experiencing, how do they apply? How does the ADA apply? But what we do know is that the ADA is still a law. The ADA still has a framework for which we make our decisions and for which we analyze those things that we are faced with on a day-to-day basis to determine whether or not there is a need to apply the ADA or whether the ADA is applicable or not. And we can't forget that. In some of the work that we do with the Great Lakes ADA Center, we've had to constantly remind business, people with disabilities, family members, educators, etc., that irregardless of the pandemic, people still have rights. And while there may be some things that we need to address that might appear to be not fair or be viewed by some people as being discriminatory, we have to take them in the light of the current situation and the current circumstances. There is no blueprint, as I said, for this. Some of the things that we're doing, we do not have the answers for, or we're just starting to explore or just starting to apply some of the thoughts and things towards these issues as they develop. So I'm going to spend some time today talking a little bit about where we are at, what's going on, where we're going, what we can expect moving forward. So let's start with just some facts related to disability. Now we're in the year of the census, the 2020 census. So our statistics and our numbers related to people with disabilities are expected to change in the next several years as that census data gets synthesized and processed. But right now we're looking at the fact that about 40.6 million people, about 12.6% of the non-institutionalized population have some level of disability. Now, when you add the institutionalized population, which is still numerous in this country of people with disabilities, you're probably up closer into the 54 to 56 million Americans having disabilities. About 40% of people over the age of 65 have some form of disability. We know that aging itself creates limitations for individuals, and those limitations increase with our age. About 32% of Americans with disabilities aged 18 to 64 are in the workforce. Now, these numbers, and we're going to talk about them in a minute, have been impacted significantly by the coronavirus and the current economic status of our country. But we also know that about 2/3 of those that are unemployed people with disabilities state that they would rather be working. And again, we expect those numbers to go up as more people with disabilities become unemployed as a result of the pandemic. Our current workforce statistics, according to the U.S. Bureau of Labor Statistics, which is published on a monthly basis and maintained on the U.S. Department of Labor Office of Disability Employment Policy website, shows for June of 2020, which is the most recent statistics that we have, the labor force participation for people with disabilities was about 20% compared to about 61, almost 62% of people without disabilities. That number has continued to be somewhat stable proportionally for people with disabilities and without disabilities. However, the unemployment rate for people with disabilities has risen significantly, as it has for people without disabilities as a result of the pandemic. Right now, we're at about 16.5% of people with disabilities who are unemployed compared to about 11% of people who without disabilities. This is the highest unemployment rate of people without disabilities that we've had since the recession in the mid-2000s and even before that. It's unprecedented unemployment rates at the present time. We know historically, as we've looked back to every time there's been a hit in the economy in the United States, people with disabilities have been disproportionately impacted by that unemployment. Often there's different reasons for this, but one of the main ones is that when the unemployment rate of people in general goes up, that means there are more people in the workforce competing for a smaller number of jobs. And because of some of the issues that we continue to experience with attitudes and things and reluctance on the behalf of employers to hire people with disabilities, we often find that people with disabilities are the last ones to be offered positions or jobs, or struggle the most in trying to get reemployment when they've lost their job due to economic factors. I'm going to spend a little bit of time talking about both challenges and opportunities that we have in the current circumstances and current situations. As I indicated, the trend for higher unemployment rate is currently in place for people with disabilities, largely due to the business shutdown closures across all sectors. When you look at some of the sectors that employ people with disabilities, such as the food service sector, the hotel, the leisure, recreation, community sectors, and things of that nature, while those are often lower paying jobs, they often are also positions that a lot of people with disabilities are working in. However, when all of those things shut down, with restaurants closing down, the travel industry basically coming to a halt, et cetera, in March, and very, very slowly reopening in subsequent months, we have not seen people with disabilities going back into their positions. People with disabilities are often working in retail, and as many retail establishments have had to limit their staffing, have had to limit their number of people in the stores and things of that nature. They were closed for a long period of time. Again, people with disabilities often are laid off and not necessarily brought back, or again, competing with a lot of other individuals for those limited number of jobs that are available. There are also things that exist within the disability community that make it more difficult in some situations for some to come back into the work world or the traditional work environment they might previously had been in, such as working in positions of public exposure due to virus exposure if they are an at-risk individual due to their disability. The inability to wear facial coverings by some people with disabilities may preclude them from certain types of job opportunities that might be available. Many employers, many workplaces, many spaces in the public are required to have facial coverings. So if I, due to my disability, cannot wear those facial coverings, not only does it impact my ability to participate in the community, but it also may impact my ability to have a job or a position and maintain that position. Transportation presents a risk for individuals in regards to exposure for the virus. And if I am reliant on public transportation to get myself to and from work, then there may be limitations there for me as well. I may not have access to a private vehicle to drive because I am unable to drive due to my disability. I may have economic factors that play in to that particular issue as well. So this has all factors that play in, and I'm sure there are many more as well. Now, at the same time, when there are challenges, there's often opportunities. So we've seen some opportunities arise, and we know that these are opportunities that will probably carry forward into beyond the pandemic, and that is that the move or the push to the virtual work environment that became a necessity for most businesses with the closure of the economy in mid-March means that there's greater opportunities for people with disabilities to work in the virtual environment because we've demonstrated that it can be done. Many, many times prior to the pandemic, we would have calls in our office from individuals who were struggling with their employers because of requesting some type of alternative work environment, work at home, et cetera, for a variety of different reasons, fatigue, other kinds of things. And we're often told by their employers that no, we have a policy where you have to work in office. We don't have any at home or virtual work environment policies, et cetera, for anybody. Well, that has kind of changed. Employers have demonstrated that they can do it. In many situations, employers have demonstrated that it's more effective for them to do it. We're hearing from employers that there are some employers that are considering never even bringing their employees back into a regular traditional work environment and keeping everybody virtual, or increasing the number of people they have working virtual, or doing a hybrid of part virtual, part in office, reducing their footprint, reducing their real estate holdings and things of that nature. These are all things that potentially offer opportunities for people with disabilities who might be able to work in some of these more traditional work situations in a more untraditional or non-traditional way, or virtual work may become the traditional work environment of the future. We're also seeing new technologies or emerging technologies being developed that make things easier or more readily available. Well, we've always had artificial intelligence, and we've had speech to text and other kinds of things that have been around. It hasn't necessarily been as perfected or widely available, and we're seeing more and more of that being now integrated into virtual meeting platforms and things of that nature out of necessity for business and by demand by business. These will have a positive impact on those individuals who rely on these kinds of technologies in order to function or to get adequate communication access. Some return to work considerations as we look forward in the reopening of the economy and the return to the workplace. We know that we have individuals with disabilities who are considered to be at risk. They're going to be at-risk employees due to their own health condition, which precludes them from potentially being in congregate settings, or puts them at risk from being in congregate settings, puts them at risk of taking public transportation, puts them at risk of being in elevators with multiple people or any kind of crowded situation. Or those are individuals who they themselves don't have a health condition, but they are residing in a household where there's household members that do have health conditions that are at risk for COVID. And so now we have the concern of their transmission of the disease because of them being out into the community, at the work environment, traveling back and forth and such. What kind of risk are they coming back into the home and potentially exposing their family members, their vulnerable populations? Could be a sibling, could be a child, could be a spouse, or other family member or household member. We're having a lot of questions come into our office around permissible inquiries, requirements that employers and businesses are placing on individuals prior to being able to enter or to come back into the work environment. One of them is facial coverings while in public spaces inside and outside. There are legitimate safety concern issues related here to the use of facial masks. The research has shown that the use of facial masks greatly reduces the potential of transmission, protects individuals and protects others from the spread of the disease. These can be argued to be legitimate safety requirements for an employer or for a business. And while I may have individuals with disabilities who, due to their disability, are unable to wear a mask, it may be that it is permissible for them to be denied access back into the work environment, into a place of public accommodation, a store, a restaurant, etc., because of the fact that they cannot wear a mask. We're hearing from entities that they're requiring temperature monitoring when I'm walking in the store, coming into the office, into the lobby, etc. Many people are concerned that this is a medical inquiry, which they know are prohibited under the Americans with Disabilities Act. However, what we're hearing from the federal agencies that enforce the ADA, that these kinds of inquiries can be argued to be legitimate safety requirements And as long as they are applied to everybody and not singling out individuals with disabilities, they are not considered to be discriminatory. Other permissible inquiries that we are hearing and that are allowable are things like, have you got a fever? Have you any symptoms? Have you been exposed to COVID-19 in the last 5 days, 10 days, or things like that? Have you traveled out of country? Have you traveled to states that have high COVID exposure, et cetera? All of which, again, permissible inquiries, legitimate safety concerns, legitimate safety criteria, as long as everyone is being asked those and not just people with disabilities being singled out. As I said earlier in my comments, that sometimes we are forgetting, or there's a tendency to potentially forget the fact that in the light of something like the pandemic, do all other rules and regulations get thrown out the door? No. The ADA is still very much in place. The tenets of the ADA are still very much front and center and core, which means that we still apply the ADA and the reasoning of the ADA to decisions that are made, including those decisions that relate to whether or not an individual can return to work and whether or not, due to their disability, they have limitations that may impact their ability to return to work, or they may require a reasonable accommodation. The reasonable accommodation process still applies. The interactive process is still relevant, and the employer has the responsibility to engage in such and to consider a variety of different potential reasonable accommodations that might work in any given situation. They may be temporary accommodations, they may be long-term accommodations. They may be issues of allowing somebody to continue to work in a remote environment, or a hybrid schedule of alternating work in office and at home. Or as a last resort, looking at reassignment when someone is unable to do the position for which they are hired and currently hold due to their disability and potential interference with the pandemic. Would they be able to be looked at for a reassignment to a different position? So for example, maybe I'm in a customer service position where I am responsible for greeting customers, patients, et cetera, in my environment, and that's a face-to-face as we reopen, and I need it in that position. It's not something I can do remotely. But due to my disability, coming back into the workplace, due to my own potential exposure to the COVID-19 or my inability to wear a facial mask, means I may not be able to do the position for which I currently hold. Are there alternative positions available that are currently vacant for which the employer would be able to reassign me either on a temporary basis or on a long-term permanent basis? These are all things that employers need to look at and need to consider as options as they explore return to work for their employees, particularly their employees with disabilities who may identify reasonable accommodation needs. How do the accommodations that I previously were provided in the workplace apply in a work at home or a remote environment? What kind of technologies do I need in order to be able to still be accommodated? What kind of policy changes are necessary for me to be accommodated? Where I may have been used to meeting with my supervisor on a regular basis to review my work, how can we accomplish that remote? Or maybe I have anxiety and the remote work is creating or increasing my anxiety because of the high amount of screen time that I have are required to have. Are there ways that we can look at that? Am I always required to have the camera on? Can I have the camera off at times? Can I have scheduled times that I do not have to be on screen or on call? These are all things that employers would need to explore and look at as reasonable accommodations in the virtual world, the same as they might have to do that in a traditional work environment where somebody might need downtime or somebody might need an additional rest period or something of that nature. The need for reasonable accommodation does not go away just because we might be working in different environments and under different contexts. Looking beyond the workplace, we look to community accessibility. So as I said earlier, we've made significant strides in the last 30 years for accessibility to our communities, yet physical barriers still remain. We still see a large number of businesses who have never removed barriers, who continue to have stairs or steps, or too narrow an aisles, or no accessible restroom, or other types of limitations that preclude people with certain types of disabilities from being able to participate. We need to continue to hold our businesses accountable for their accessibility. Attitudinal barriers remain one of the biggest barriers for people in a variety of different situations. At the signing of the ADA 30 years ago, President Bush said that while we can legislate ramps and we can legislate what a building looks like or how it's constructed, one thing we can't do is legislate attitude, because that comes from within, that comes from the person, the individual. And businesses and companies and corporations need to continue to look at this particular issue, and we continue to try to move that needle as it relates to attitude. One of the key things is staff training. And I think COVID-19 has really brought this out as more and more of a need and more of an issue. How important it is to do staff training, to understand the compliance issues that their businesses have. Making sure that their staff are familiar with their policies and procedures. Things like, what kind of alternative services do we have available, curbside or home delivery, and how do we implement them? How do we provide sign language interpreters or real-time captioning to ensure effective communication? What formats are we able to provide written information in? When I can't go and get a pamphlet anymore, such that nature, how am I distributing information? If I'm distributing information via social media, if I'm distributing information via my website, am I ensuring that it's accessible? More and more information is being distributed through Twitter, through FaceTime, through Facebook, through Instagram, through LinkedIn, etc. All of these platforms need to be made sure that they're accessible with the content that I post. Is my website accessible? Are the kiosks that we're using, or the apps that we've developed accessible? All key issues and all key around the issues of attitude. Because if I, as a company or a corporation, have an attitude by which people with disabilities are not valued as customers and not valued as employees, then these other issues are not going to become important to me. So I need to make sure that we embrace inclusion as a company, as a corporation, and we make these things as priority. In the context of COVID-19, we know that there are fewer businesses open in our local communities and neighborhoods, making it more difficult for people to access goods and services, oftentimes potentially even more expensive, as they have to do delivery fees and things of that nature. We know that the barriers exist for individuals, as I've mentioned already, who are unable to wear face coverings, who now have limited options for shopping and dining. There are legitimate safety criteria in place for business to preclude somebody who's not able to wear a face covering from entering their business or their establishment, but that does not preclude them from having to offer alternative methods for which that individual can obtain the goods or services that are provided by that business. They may not be my preferred way to receive those services and goods, but the issue is there still an alternative available to me? We know that transportation services are limited, as I said earlier. Not only does that impact my ability to go to work, but it impacts my ability to get around town, participate in the community, go to my medical appointments, things of that nature that I may still need to deal with. There's decreased capacity on trains and buses, decreased schedules, limited assistance being available for paratransit services due to social distancing. So some of the assistance that people are used to getting to help them get on and off or get from their door to the vehicle or back with their packages and things that are no longer being provided because of social distancing requirements, fear of transmission, close contact, which means I may need to travel with a companion when I'm not used to it. When I'm used to traveling on my own independently, I may have to re-examine and look at other options because of that. Is this long-term? We don't know. Lots of unknowns yet, but I need to plan accordingly. We know that communication access has become more and more difficult for people who rely on reading lips or facial expressions for their communication due to being deaf, hard of hearing, or having other kinds of disabilities that affect their communication. We know that there are masks available that have clear areas for the mouth. We know they're a limited supply. We know that many entities have not purchased them or don't purchase them, won't purchase them. So it does impact the communication for individuals. We have to look at what alternatives can be still provided, what methods can still be used to ensure that someone can communicate It may not be the preferred method of communication, but we still have to explore opportunities and options available. Think outside the box. Can we use other technologies and such to communicate effectively? There's an uncertain future for education at the K through 12 and post-secondary level. When schools shut down in March, we originally thought it might be for a month or two. It then stretched to the end of the semester, stretched into the summer, and now we're quickly approaching the fall, where schools should be back in session again and kids should be running around on the playgrounds and such. Yet playgrounds remain closed, schools remain closed, and it still remains uncertain whether or not schools will return in person or virtual or some blend thereof. We know that there's a great deal of concern and issue and discussion around the fact that many individuals with disabilities are at a disadvantage in the virtual education environment because of the type of accommodations necessary to ensure an effective communication experience for them or an effective learning environment for them. Great deal of discussion being held around what are the alternatives or what could be the alternatives for individuals with accommodation needs in the classroom that can't be necessarily met in the virtual environment. A lot of creativity is starting to be generated around these particular issues. More policy issues being explored as to how some modifications in existing policies may be implemented to facilitate this, better learning, better opportunities. It's been recognized that the school systems have largely ignored the needs of students with education, special education needs and things of that nature. We know that many individuals don't learn the same as everybody else and thus are disadvantaged by some of these virtual environment learning opportunities. There's also concerns for vulnerable teachers and other staffs returning into the school and the exposure they may have, or again, their exposure that they might take home to vulnerable populations that they live with. So a lot of questions still remain in the education arena. The bottom line is, though, that students with disabilities still have a right to free, appropriate public education. Individuals with disabilities still have a right to be accommodated so that they have equal opportunity in the classroom to learn, to experience the educational opportunities that others do. We just need to continue to work towards solutions in this area, and they are ever evolving. We also know that there's an increased risk for persons with disabilities who are living in institutional settings such as nursing homes, group homes, etc. Great deal of attention initially paid to the fact that the death rates within nursing homes and other congregate settings was much higher, and that many of the deaths that were occurring in Illinois and other places were occurring in these congregate settings, and a push for moving people out of nursing homes, especially those who shouldn't have necessarily need to be in a nursing home but are only there because of policy issues and lack of services and programs and supports in the community that would allow them to live independently in the community. The disability community has rallied strongly behind the efforts to try to move people out of the nursing homes and into community settings for a greater chance of survival in the pandemic times and greater opportunity to realize the promise of the ADA, for which was brought forth under the Olmstead decision in 1999, which says that states should provide people with options for living in the community, which many of our states have failed to do. We also know that people are experiencing limited access to healthcare due to limited access to the hospitals and such have closed down, elective visits and things of that nature have shut down or been greatly reduced. Telemedicine, but many people don't have access to some of the technologies that would most benefit them from a telemedicine perspective, or where appointments are being done still in person. People are being limited as to who can go with them or be with them, and often not being allowed to provide the supports that may be necessary to facilitate their communication or other needs that they might have during those appointments. More and more medical institutions are modifying policies and procedures to allow at least one person to be with an individual with a disability at a medical exam or in a hospital situation and such. But these are continuing concerns and ongoing areas for advocacy. So where is the bright light in all of this? Well, as I said, and as we started, and that's why we're here today, is as we celebrate the 30th anniversary, we need to acknowledge our challenges and look at what today brings, but also look forward to the promise of tomorrow. And we know that because of the pandemic and because of the policy and advocacy efforts of individuals before us and during this time, and I know that we'll be moving us forward today and tomorrow, we're seeing increased financial assistance directed to social service providers to address the needs of persons with disability in the community, independent living centers, homeless shelters, aging programs, receiving more and more support. We're seeing some increased financial assistance being directed to cities and schools to address the needs of vulnerable populations within the communities and within the schools. More is still needed. We're seeing an increased knowledge and understanding of the barriers that are created by the pandemic and better planning for the future and what it might bring. The disability voice is finally at the table. It was slow to get to the table, unfortunately, because not out of a lack of desire, but more from struggles to try to be heard. And once that disability community is heard, they have not stopped talking. And they are continuing to push and push and push and get more and more recognition for the needs of people with disabilities today and tomorrow. We also see that we're recognizing that there are things that can be done differently than they've been done in the past out of necessity, and that these very same things and methods could be used to be sustained even after the pandemic to increase opportunities for everyone. Virtual work, more technology to do business, etc., all have the promise for more access for tomorrow. And we need to continue to drive those areas forward and to continue to give our input and push for more and more, not to be satisfied for where we are. And I leave you today with a reflection on the 30th anniversary shared with me by a member of my staff, Peter Berg, who's our technical assistance coordinator at the Great Lakes ADA Center. And he said, take a moment today and every day to recognize all the incredible accomplishments experienced over the past 30 years. As a result of the ADA and the tireless advocacy of the disability community and their allies, we have a society that is more accessible and accepting of people with disabilities. We have accomplished a great deal and still have work to do in order to achieve the full inclusion of all society, including employment, business, healthcare, technology, and so much more. I'm more than happy to take your questions. This is how you can get in touch with me at the Great Lakes ADA Center. I provided my office phone number, my cell phone number, as well as my email address, and invite you to visit our website at www.adagreatlakes.org. So again, my name is Robin Jones. I can be contacted at 312-996-1059, which is my office, or 312-208-0754, which is my cell, or by email at Guinness, GUINESS, at uic.edu. I've also provided you some resources for additional information on the Americans with Disabilities Act if you'd like to delve in and get some more information. That includes our office with our 800 number, 800-949-4232, and our website again, www.adagreatlakes.org. The U.S. Department of Justice has some great information available on its website for the Americans with Disabilities Act, which is www.ada.gov. They also have a technical assistance line that is available at 800-514-0301. The Equal Employment Opportunity Commission, which enforces the employment provisions of the ADA, has some excellent information, particularly around COVID-19 and its impact on the workplace and the Americans with Disabilities Act, at their website at www.eeoc.gov. And the Job Accommodation Network is an excellent resource funded by the U.S. Department of Labor, Office of Disability Employment Policy, has a website with a wealth of information on reasonable accommodation in a variety of different settings and across a variety of different disabilities, including impact of COVID-19. And their website is askjan, ASKJAN.org. So please feel free to do some more research and get some more information, and always contact our office. We're happy to help you at any time. So again, happy anniversary on the 30th anniversary of the Americans with Disabilities Act, and thank you for your participation in today's session.